Hi everybody, I am Naufal. Welcome to my channel. Today we are going to discuss regarding roles of community health nurse. We know the trend of the community health nurse is changing. Now the community health nursing sector is a challenging department. So the community health nurse should perform different roles. So we can see the different roles of the community health nurse one by one. First one is as a advocate. The community health nurse should perform as a advocate. So regarding the advocate, regarding the treatment, what are the treatment that can be accepted by the patient, what are the treatment that can be rejected by the patient, regarding the treatment facilities, regarding the rules, regarding the laws, and regarding all the legal matters related to the health. The community health nurse should give the information to the community people, to the family members. As an advocate regarding the health matters, regarding the legal issues of the health, the community health nurse should work as a legal advisor. The community health nurse should give the information regarding the health. What are the treatment facilities available? What are the treatment you can accept, and regarding the rights of the patient and the rights of the community members related to the health. So as an advocate, the community health nurse should perform. That is the first role, that is as a advocate. Next one is as a caregiver. Next role of the community health nurse is as a caregiver. We know that in the community health setting, we are giving care at the home setting, directly at the home of the patient. Directly we are giving the care at the home of the patient, home of the community members or the family members. The community health nurse is giving the care, as well as in the clinic, as well as in the health centers. The community health nurse is providing care, that is caregiver, directly providing care to the patient, directly providing care to the family members at the home setting, at the clinic setting, and at the health center setting. The community health nurse will provide direct care to the family members and to the community people. Okay, that is the second role of the community health nurse. Next role is as a counselor. As a counselor. So the community health nurse should provide counseling to the family members when they are in a crisis, when they are facing a problem. The community health nurse should provide counseling to the family members, as well as during the environment is changing. Nowadays the technology is developing. So to the changing environment, the community health nurse should provide counseling. Whenever they are physically or mentally they are weak, the community health nurse should provide counseling to the family members. So the community health nurse should work as a counselor. That is also a role of the community health nurse. Next one is as a case finder. Next role of the community health nurse is as a case finder. To identify the case is a important part of the community health nursing. As a case finder, the nurse should try to identify new cases, new diseases in the community. For that, the nurse has to arrange different camps, different screening camps, regarding the health camp, regarding the health checkup, regarding the blood test, regarding the eye test. So from that camps, the nurse can identify different diseases. The nurse can identify the cases. That is as a case finder, finding the cases, different diseases. For example, the nurse can identify the diabetic patient during the health camp, as well as the hypertension patients the nurse can identify, as well as the cataract patient during the eye camp. So as a case finder, the nurse should identify the need of the community people. The nurse should identify the need of the community or the family members. Case finder means finding or find out the cases, find out the diseases of that community. That is as a case finder. Next one is as a collaborator. Next role of the community health nurse is as a collaborator. As a collaborator means coordinating and associating the different community health services. We know in the community health setting there are so many services. For example, immunization. It is a part of coordination and collaborating or associating the community health services and coordinating and associating or collaborating with other health team members. For example, with the auxiliary nurse as well as with the health assistant male, health assistant female, lab technician, pharmacist and the medical officer. So as a collaborator, the nurse should coordinate the work, the nurse should associate the and coordinate the health team members also. So coordinating the work and associating the work as well as different programs. We know, for example, National Tuberculosis Control Program. So coordinating that program and associating that program and the health team members is an example of as a collaborator. So nurse should collaborate the different community health services and different community health programs. That is the role of the community health nurse. Next role is as a advisor. As a advisor. In the community and the family members will have so many doubts. So regarding their doubts, the nurse should provide different advices to them. Nurse has to clarify the doubt as well as provide advices to them. Provide the advices like importance of sleep, importance of the rest, importance of the exercise, regarding the dietary pattern and all. If they have the doubt, the nurse should provide the advices. So the nurse should work as a advisor, providing advice to the community people, to the family members as well as to the patients. The role of the community health nurse is as a advisor. Okay. Next role is as a epidemiologist. Next role of the community health nurse is as a epidemiologist. As a epidemiologist, we know epidemiology means the study of the occurrence of the disease, how the disease is occurring and regarding the distribution of the disease. With this knowledge of the epidemiology, the nurse should identify the how the disease is occurring, and using the different methods of epidemiology, the nurse should try to prevent the occurrence of the disease. As a epidemiologist, using the knowledge of the epidemiology, that is the epidemiology is the study of the occurrence of the disease and the distribution of the disease. So using the epidemiology technique, the nurse can identify the occurrence of a new disease, and nurse can use the different epidemiological methods to prevent the different diseases. Okay, that is the next role of the community health nurse as a epidemiologist. Next role is as a team leader. So in the community health team, there are so many members. For example, auxiliary nurse, health assistant male and health assistant female, the health educator, lab technician, pharmacist, everybody will be there. So as a team leader, the nurse should have the quality of the team leader, and nurse should perform as a team leader in the health team as well as with the community people while performing different programs or while providing different services. Nurse should act as a team leader. Nurse should work as a team leader. That is also the role of the community health nurse. Next role is educator. Next role of the community health nurse is educator. So the ultimate aim of the community is to prevent the disease as well as to promote the health. To prevent the disease, the nurse should inform or the nurse should educate regarding the importance of vaccination, that is importance of the immunization. As well as to promote the health, the nurse should tell the importance of the rest, sleep, dietary pattern, exercise and all. All these things can be done by health education. So health education is an important part of the community. Through the health education only we can develop the health of the community people. So the role of the community health nurse as a educator means educating the community and the family members through health education. These are the different roles of the community health nurse. We will meet soon with another video. Till that time, thank you and goodbye.